Excellencies, prospective members of the various boards, ladies and gentlemen, good morning. It is with profound respect and sense of great expectation that I extend my warmest congratulations to all newly appointed members of the boards of our eminent teaching hospitals, namely Korle, Komfo, Anokye, Tamale, Cape Coast, Sunyani, and Ho, as well as the Food and Drugs Authority and the Ghana College of Physicians and Surgeons. Your appointment is no mere accolade. It is a solemn call to service at the highest level of stewardship in our health sector. Today is not simply an occasion to exchange pleasantries or bask in the honor of your new roles. It's a moment of reckoning, a moment to recognize that you are now the custodians of institutions that are the bedrock of Ghana's health system. The decisions you make, the leadership you demonstrate, and the integrity with which you govern will profoundly shape the health and well-being of millions of compatriots. This government, the decisive leadership of His Excellency John Dramani Mahama, has set forth a bold and transformative health reset agenda. To translate this vision into reality will require more than good intentions. It will require measurable outcomes, unyielding commitment, and a relentless focus on results. Accordingly, each of you will be required to sign a performance contract that articulates clear and ambitious key performance indicators. These will not be mere formalities, but active tools of accountability with regular progress reports submitted to my office for rigorous review. A central tenet of your mandate will be financial discipline and operational efficiency. It is imperative that every cedi entrusted to your institution is stretched to its fullest potential in service of the Ghanaian people. We can no longer tolerate the wasteful practices of the past, where administrative overruns swallowed up most of our annual budgets, leaving our facilities starved of resources for maintenance, infrastructure development, and service improvement. That chapter must now be closed permanently. In pursuit of this, I expect every board to rigorously assess the necessity, frequency, and the purpose of its meetings. Meetings must not become perfunctory exercises or routine engagements. They must be conveyed strategically, driven by a clear agenda and geared towards advancing the institution's mandate. Governance must be purposeful, efficient, and impactful. Furthermore, I am directing that all hospitals establish and maintain two distinct accounts, one dedicated to the upkeep of infrastructure, covering essential activities such as painting, roofing, repairs, and minor facility restorations, and another earmarked exclusively for the maintenance and servicing of critical diagnostic and medical equipment. It is inexcusable to preside over the decline of the very assets that are indispensable to the delivery of care. To let the hen that lays the golden eggs fall into rain is a betrayal of the public trust and of your duty. Maintenance is not an optional extra. It is a fundamental obligation. We must cultivate a robust culture of preservation and proactive stewardship, one that reflects an unwavering commitment to building institutions that are resilient, responsive, continuously improving. No longer can we fall back on the convenient narrative of blaming government when things deteriorate due to our own lapses in vigilance and care. Let me now turn to an issue of serious national concern: the alarming influx and abuse of opioids. This crisis has laid bare serious vulnerabilities in our system of medicine regulation and surveillance. It is a stark indictment not only of our internal controls, but also of our ability to safeguard the health of our citizens. We cannot and will not allow this crisis to spiral further. I hereby charge the Food and Drugs Authority, whose board is being inaugurated today, to redouble its vigilance and intensify its regulatory and enforcement efforts. You must strengthen your surveillance systems, tighten your licensing protocols, and work collaboratively with all relevant stakeholders to ensure that illicit and dangerous substances are swiftly intercepted and eradicated. I stand ready to lead this charge, and I pledge the full support of the Ministry of Health in working alongside our national security apparatus to dismantle the networks that threaten the safety of our people. This is not a battle we can afford to lose, and we must pursue it with unrelenting resolve. To the boards of the Ghana College of Physicians and Surgeons, the role is equally pivotal. With the establishment of the Ghana Medical Trust Fund, what we have aptly named the Mahama Cares Initiative, we are poised to remove the financial barriers that have long prevented many Ghanaians from accessing care of non-communicable diseases. As these barriers fall, we anticipate an unprecedented surge in demand for specialized medical services. This is your moment to rise to the occasion. We will rely on you to not only increase the quantity of specialists and consultants you train, but to ensure that they emerge as practitioners of the highest caliber, technically proficient, ethically grounded, and deeply empathetic. Our vision is for every region to have access to skilled professionals in cancer care, chronic and end-stage kidney disease management, dialysis and organ transplantation, bringing advanced medical care within reach for all. Moreover, I urge you to instill in the next generation of specialists an expanded understanding of their Hippocratic oath, one that transcends technical duty to embrace fairness, compassion, and dignity in the treatment of every patient, regardless of circumstances. In conclusion, let me remind you that the position you now hold you are yet to be solving anyway. Not privileged to be enjoyed, but responsibilities to be handled. The trust placed in you by the government and people of Ghana is immense. I urge you to carry it with integrity, with purpose, and with unwavering conviction that together we can and will build a health system that truly serves our nation. I thank you for the opportunity.